Welcome to Arazy Group's regulatory update. In today's update, we are going to give you a regulatory wrap-up in South Korea that will include information about Medical Device Act and Regulation Revisions 2026, published in a regulatory update issued by the South Korean Ministry of Food and Drug Safety, MFDS, on June 26, 2026. The update introduces two separate regulatory amendments. The first amendment concerns the regulation on the permission, notification, and review of medical devices, and became effective on April 28, 2026. The second amendment concerns the Medical Device Act and became effective on July 1, 2026. Previously, only Class 2, 3, and 4 medical devices were eligible for a 6-month transition period following approval of a change. Under the revised regulation, this provision has been extended to include Class 1 medical devices. As a result, manufacturers and importers may continue supplying products manufactured under the previous approval for up to 6 months after the change approval is granted. The revised regulation expands the acceptance of real-world evidence, RWE, in support of medical device applications. Previously, RWE could only be used in place of clinical trial data for a limited number of innovative medical device categories. Under the revised regulation, manufacturers may also use RWE to support applications involving modifications to existing medical devices. The revised regulation also simplifies the documentation requirements for regulatory submissions. Previously, supporting documents in languages other than English were required to be accompanied by a notarized translation. Under the revised regulation, manufacturers may submit a standard translation together with a confirmation that the translation accurately reflects the original document.
If you want to manage your product registration, consider Regislate, our global registration management software for fast and effective market access processes.
The amended Medical Device Act introduces several significant regulatory changes. Manufacturers applying for quality management (QM) conformity recognition are now subject to assessment fees. The Act also strengthens MFDS enforcement powers by permitting the revocation of conformity recognition where it has been obtained through false or fraudulent information. The amended Act also introduces measures to enhance transparency within the medical device market. Medical device distributors and related parties are prohibited from selling or leasing medical devices directly to affiliated medical institutions where conflicts of interest may arise. In addition, the ministry will conduct market practice surveys every 3 years and publish the results. These measures are intended to promote fair competition and strengthen oversight of medical device distribution practices. In summary, these amendments aim to reduce administrative burden while strengthening regulatory oversight. From a regulatory affairs perspective, the most significant changes are the extension of the 6-month transition period to Class 1 medical devices, the expanded acceptance of real-world evidence, RWE, and the simplified requirements for translated supporting documentation.
Thank you for following our regulatory updates. If you have any questions, need more information, or would like to book a demo of our software, please email us at info@arazygroup.com, or simply head to our website and head to the Contact Us page.